Hello everyone, I'm Kyra, and this is the Forum 8 video for the discussion board for the Social and Behavioral Theory Applications in Public Health for Liberty University. I am here to talk about what makes a good interprofessional service member for public health. A good interprofessional service member for public health works to improve the health of the whole community. Did you know that the leading cause of early mortality is from unhealthy behaviors? A person's behavior is what determines their health. If they choose to smoke, they have higher chances of contracting lung cancer. If a person chooses to continually eat junk food for long periods of time, they may contract heart disease and stroke. And if they choose to be physically inactive, they may risk contracting osteoporosis. Therefore, I consider that a good interprofessional service member, specifically for public health, is one that convinces a person to change their unhealthy behaviors. To do this, specific models need to be matched to specific people. Everyone is born with different personalities and different backgrounds. By matching the model to each individual person, the service member will have a better chance of helping people change through the targeted approach. An effective service member can guide an individual through the stages of change of behavior, which includes 5 steps. There's pre-contemplation, contemplation, preparation, action, and maintenance. As long as the service member helps the person to agree to go through the intervention strategy through the first 3 steps, and continue to encourage him or her through the later 2, the individual's health will improve greatly for longer-lasting results. Additionally, core competencies for public health professionals plays a vital role for an interprofessional service member for public health. These consist of skills that are used for public health, being used in educating public health workers, researching public health intervention strategies and practicing those strategies in the community. There are 8 domains for core competencies, which include the following: analytical and assessment skills, policy development or planning skills, communication skills, cultural competency skills, community dimensions of practices skills, public health science skills, financial planning and management skills, and leadership and systems thinking skills. Analytical and assessment skills are used for gathering data for a specific health strategy, which is assessed and developed for the needs of the public. This specific skill is important because it is used mostly from the beginning to the end for intervention strategy for the public health. For example, these skills are used to analyze the data, analyze the decisions that are made for which intervention strategy works best. Moreover, one must decide which information is relevant for the said public health intervention. Financial and management skills is another core competency, specifically used for financing public health and research projects. Financial planning helps one to budget money to pay employers, fund intervention strategies that cost more than others, and etc. Management skills helps manage the organization of the program, how the program is supposed to be accomplished, and etc. Of all the core competencies, I think that communication skills plays the most important role in public health. With great communication skills means that one has higher chances of building relationships with others. Therefore, those bonds of trust means that it will be easier to convince a patient to change their behavior. Communication skills will also improve the cultural competency skills, which is needed for understanding the various cultures. If people understand the background to the individual, which includes their culture, their religion, their ethnicity, and etc., then communication between the service member and the person will greatly improve. Community dimensions of practice skills can also play a role in this by building the relationships between the community and partnerships with organizations that provide funding and raw materials. Another core competency, the public health science skills, involves applying the data from research into the public. By using these skills, one evaluates an intervention method, improves the intervention method strategy, if need be, and decides which intervention strategy works best for which individual. If a public health method is not applied to the community, then it would be a waste of time to research and gather data on the public health issue. Altogether, these skills are fruitless without leadership and systems thinking skills, which is important for organizing various projects, whether it be finances, collaboration with other organizations, education meetings, etc. An interpersonal service member indicates that a service member must work with other people, and therefore must have a leader. Sheep cannot follow without no shepherd. Therefore, a leader comprising these core competencies will be the best interprofessional service member for public health. Thank you.